Hello, my name is Jacqueline Vinnedge, and I'm going to talk to you about the exceptionality depression. Depression is a mental illness characterized by prolonged and persistent feelings of sadness, irritability, or anxiety that interferes with life's functioning. Anyone can become depressed. It does not discriminate. There are many different causes for depression. Physical, sexual, or emotional abuse from a student's past or present can cause them to feel depressed. Medication that a student is taking, perhaps for ADHD, can cause depression. Death or loss of a loved one or friend can cause sadness or grief, which can increase risk of depression. Genetics need to also be considered when dealing with depression. A family history of depression may increase the risk for students getting depressed. Major events, good or bad, can lead to depression also. Such events as graduating from high school or your parents getting divorced. Other personal problems, such as social isolation due to other mental illnesses or family-related issues, can lead to depression. Depression may coexist with major illnesses or can be a reaction to the illness. Substance abuse problems can lead to major or clinical depression. The symptoms of depression in students vary. It is often undiagnosed and untreated because they are passed off as normal emotional and psychological changes that occur during growth. Early medical studies focused on mass depression, where a child's depressed mood was evidenced by acting out or angry behavior. While this does occur particularly in younger children. Many children display sadness or low mood similar to adults who are depressed. The primary symptoms of depression revolve around sadness, a feeling of hopelessness, and mood changes. Signs and symptoms of depression in children include irritability or anger, continuously feeling of sadness and hopelessness, social withdrawal, increased sensitivity to rejection, change in appetite, either increased or decreased, changes in sleep, sleeplessness or excess sleep, vocal outburst or crying, difficult concentrating, fatigue and low energy, physical complaints that do not respond to treatment, such as stomach aches and headaches, reduced ability to function during events and activities at home or with friends, in school, extracurricular activities, and in other hobbies or interests of the students. Feelings of worthlessness or guilt. Impaired thinking or concentration, thoughts of death or even suicide. Not all children have all these symptoms. In fact, most will display different symptoms at different times and in different settings. Although some children may continue to function reasonably well in structured environments, most kids with significant depression will suffer a noticeable change in social activities, loss of interest in school, and poor academic performance, or a change in appearance. Children may also begin using drugs or alcohol, especially if they are over the age of 12. Although relatively rare, in youth under 12, young children do attempt suicide, and many do so impulsively when they are upset or angry. Girls are more likely to attempt suicide, but boys are more likely to actually kill themselves when they make an attempt. Children with a family history of violence, alcohol abuse, or physical or sexual abuse are at greater risk for suicide, as those with depressive symptoms. If you notice a significant change in mood in any child that lasts for more than a week or two, share your observation with the child's parent and/or guardian and with your school's mental health support team. Being proactive is very important when you see the signs of depression. Treatment for depression. There is psychotherapy. Due to concerns about drug safety, parents often opt to try psychotherapy before resorting to medications. Psychotherapy can be helpful to children and may be all that is necessary to help them sort out their feelings and learn the skills they need to cope with life's stresses. There are many theoretical approaches to psychotherapy, but probably the most effective in the treatment of childhood depression is cognitive behavioral therapy. This type of therapy focuses upon the role of thinking and belief systems as the root of depression. People with depression have certain characteristics through patterns called cognitive distortions, which give them a skewed perception of the world around them. During cognitive behavioral therapy, a psychologist works with the patient to help them recognize their dysfunctional thoughts and to change them to a more realistic perspective. Other types of therapy that may be helpful with childhood depression include interpersonal therapy, which focuses on interpersonal relationships and coping with conflict, family therapy, which focuses on the importance of family relationships and psychological help, and play therapy, which makes use of children's natural tendency to engage in play in order to help them work through their inner conflicts and anxieties. Medication is another form of treatment. The FDA requires that all antidepressant drugs be labeled with a boxed warning regarding the increased risk of suicidal thoughts and behaviors in children and adolescents. This risk was determined by taking data from 24 different antidepressant trials involving 4,400 patients. The analysis of this data showed that during the first few months of treatment, the risk of suicide was doubled that for those receiving only a placebo. No completed suicides occurred during the trial. Does this mean that your child should avoid antidepressants? Not necessarily. Even though the risk of suicidal thoughts and feelings doubled, this figure was still only a small percentage of the patients who were taking the drug. While it does signal the need for caution, parents should keep in mind that untreated depression can also lead to suicidal feelings. The expert opinion at this point is that the benefits of antidepressants still outweighs the risks. Speaking with your family doctor and therapist and come to a conclusion together as a family and as a group to help your child with depression is the best form of treatment. Some families have choose to use psychotherapy and medication both. Strategies for depression in a classroom. Identify one teacher or other staff member to act as the student's advocate, a check-in person, and as a point person for communication with parents. Provide built-in opportunities for the student to talk with a supportive adult who has the time and ability to listen attentively. Validate the student's experience and feelings. I know that things are really hard for you right now. Provide the student with opportunities for self-time out to regroup when they are feeling excessively sad or irritable. Teach the student to identify their mood patterns and appropriate ways to communicate anger, frustration, and sadness. Help the student to identify automatic negative thoughts and strategies for refraining these negative thoughts. Encourage positive self-talk. Strategies for motor restlessness caused from depression. Design daily lessons so that the student has to actively respond to an assignment. Integrate physical activity throughout the school day, not just contingent upon achievement. Provide the student with an in-class outlet for physical restlessness, such as a stress ball or allowing the student to stand when completing some assignments. Strategies for slowed psychomotor response caused by depression. Provide students with written copies of class notes and/or assignments. Allow flexible deadlines for work completion. Avoid lowering grades for non-academic reasons such as messy work. Allow students more time to respond when asking questions or making requests, giving the student a chance to feel comfortable in a classroom. Strategies for worthlessness and/or guilt or excessive guilt. Model that it is okay to make mistakes. Point out and make light of your own mistakes. Model how to reframe mistakes into opportunities. Provide the student with additional meaningful responsibilities. Discourage student from participating in activities that result in increased negative feelings about themselves. Demonstrate unconditional acceptance of the student, though not his or her behavior if it is inappropriate. Separate students from peers who are negative or who frequently point out the failings of others. Strategies for change in appetite caused by depression. Monitor students' eating, but do not become a food gatekeeper. Let them feel comfortable. Allow healthy grazing throughout the school day. This could provide energy for them. Provide opportunity for physical activity throughout the school day. Strategies for diminished interest in unusual activities caused by depression. Identify the student's typical interest in or favorite activities. Integrate them into the student's school day. Gently encourage the student to participate in activities with peers who have been a positive part of their lives. Do not force social interaction or participation in activities. Encourage peers to invite the student to participate in extracurricular activities. Allow the student to attend group activities without requiring active participation. Give the student opportunities to help their peers in areas in which they excel or to make important decisions about class activities. Initiate conversation with the student when they arrive, leave, and/or take a break. Getting them active into the school day can help a student with depression a lot. Suicide thoughts. Huge concern with depression in young children especially. There are signs that may indicate suicidal crises that should be acted upon immediately. Threats or attempts to hurt or kill oneself, looking for the means to kill oneself, such as a gun, pills, rope, knives. Making final arrangements, such as writing a will or a farewell letter, or giving away cherishable belongings. Preoccupied with suicide or death, in conjunction with depression symptoms or high-risk behaviors, expressed through writing, art, music, online chat spaces. Showing sudden improvement after a period of extreme sadness and/or withdrawal. It's very important to watch for these signs. Believe in yourself and all that you are. Know that there is something inside you that is greater than any obstacle. Getting youth, adolescents, and children to believe in that is hard enough on a normal day, but with depression it's even harder. Letting them know that tomorrow can be better. Being informed and educated about depression, signs, symptoms, treatments, and strategies can be our most powerful defense to help students be happy and healthy throughout their lives.